everyone, Dr. Eric Smith from Optimal Health Chiropractic here. I'm with Mike LaCombe, bodybuilder extraordinaire, 5 weeks out of his next show. And Mike, what show is that?
North Americans.
Okay, North Americans. He's been training for years. He's actually a coach of mine, many professional clients here in Illinois. So we're going to work on him today. We're going to work on doing some Graston technique or some muscle activation technique and such on his legs, where we're going to work on the fascia. And what the fascia is, it's an encasing around the muscles, and we're going to just start getting some of these adhesions and other things from all the years of training loosened up, so it's actually going to bring out his definition, allow his muscles to grow a little bit more. So you'll see at the end of the video there's some before and after pictures. You get to see what we're going to do with not only his quads today, but we're going to work on his back. So I do this on a lot of different patients, and this can be used in many different forms with different tools. The technique I'm using today is just to really kind of bring out the definition. So we use a type of emulsion type massage cream here. We're going to get into some points. There might be some tender points that you'll find when we do this technique. Realistically, there's lots of different tools you may see practitioners use, but realistically it's really the use of the technician and how they're doing it and what the goal is. So I've used this for neck pain, I've used it for low back pain, I've used it to bring bodybuilders' definition out, I've used it where people have had surgeries, and it's very, very helpful in all those cases. So we're just going to start here on his right quad. So if you'll come over to face this way, you'll see that I'm going to use this bigger tool to kind of just get in. So first off, I'm kind of using this to just feel for these little adhesions, and they should feel like bumps. So Mike, are you feeling any bumps or anything as you go across?
If you're actually close too, you can hear the actual adhesions breaking up. It's pretty well.
Sound like a little like crackle and pop, right?
Yep, snap, crackle, and pop.
So one thing you'll notice as I go over a few of these areas, you'll see it's going to start to get red. So that doesn't exactly mean that a certain area is working better or anything. It just pretty much is bringing blood to that area, breaking up those adhesions. And then later, as we do and get in a little bit deeper, you'll find the definition come out a little bit more. But now I'm just finding some of these other tighter areas, which right through here where his tendons are attaching into the muscle and the bone, we tend to find a little bit more. So as you see, I'm going to dig a little bit deeper. Is this painful, Mike?
No, not yet. We'll get there, I'm sure.
So it can be painful for some people. Usually it doesn't have to be painful, and it doesn't take a lot of work on the technician side to typically get in there. Now Mike has a lot of different adhesions in different points of his compartments of his quads here. So you're going to notice certain areas and maybe even some lines come out as we do that. This bar right here is kind of for bigger areas. I do have a smaller tool that I'll be using in just a moment. So if you have any questions about how this would work for you, you can definitely contact us at the website, give our office a call, and see and inquire if this would be right for you. It's not right for everybody. If you're on any blood thinners or any type of thing that's going to make the skin bleed a little more, this might not be right for you, but you can inquire with your physician to see. So now that I've kind of done some bigger just grazing over here, we're going to dig a little bit deeper. Yeah, we can see it really up here. We're going to try to bring out where I've seen his quads come out a lot through here, is this almost raindrop definition that he has. And I can feel the deeper adhesions through the deeper part of the quad. So as you can kind of see, it looks like I'm pushing a little bit harder, because I definitely am. And if you want to, Kristen, you can come behind me if you can see the angle. You can kind of see. So now what I want to do is just switch the tool use over to something a little bit
more painful.
A little bit more painful, he says. So I'm really just grazing over all this tissue and going to bring out where this tendon's attaching more toward the bone and make sure that this is moving the way that it should. And one thing with Mike, we've noticed that as we get along kind of the IT band area in this lateral part of his quad, the more we can bring this out, the bigger and more full his legs look.
Now you can kind of hear it. Sounds like cheese grating.
Sounds like a cheese grater, exactly. Right behind you. Is this getting more painful, or do you just feel it's like starting to come out a little bit more?
Yeah, I just you start to feel obviously more friction. The tool's a little bit more precise, I think.
Mm-hmm. So I like to use the smaller one when we're really trying to get in and work on the edges of the compartment here. This tends to be a little bit more sensitive on the inner part of the leg.
Yeah.
So sometimes you'll see the patient squirm a little bit, but we just work through it. And what you'll notice too, last time we did this, how long would you say the red mark stayed?
4 to 5 days probably till it completely diminished. We got pretty deep in.
Yeah, the last few times we got pretty deep in because we were trying to get some of that out.
I think this will probably be a pretty good marking because this is the first time we've done it this prep. So, and I've added a lot of tissue since we've done it. So,
yeah, it's probably been a good year since we've done this or so. So this is just kind of the beginning of what we wanted to do, but I wanted to show you. So we'll be putting another video out of him doing on the back, but if you have any questions of Graston technique or any type of release technique would be good for you, feel free to give our office a call. There's a link at the bottom where you can actually inquire if you want to set an appointment up, or like I said, if you have any questions, feel free to give us a call. Thank you very much.